So my first question is on corneal crosslinking, and this is something I knew nothing about. So I love doing these webinars because, you know, we learn so much ourselves, and really the best way to learn is to try and teach it. So anytime that you have a coding question that you're trying to come up with, think about if someone asked you to present at a local AAPC chapter. How would you go and start collecting the information? But okay, so here's my question. If you could scroll up just a little bit, they were asking about this procedure. So apparently they must work for an ophthalmologist and they're trying to get paid for it and they can't find the CPT code. What this reminded me of is for about a year, and I was actually a fairly new coder, I worked on a coding hotline where I had to answer questions like this. And 90% of the time, the answer was, sorry, you have to use an unlisted code. And that's not what people wanted to hear, because with unlisted codes, it means you have to send in documentation, try and fight to get paid. So this is much like that. So the first thing we had to figure out is, what is it? What is corneal crosslinking? So the best resource I found was from the Cleveland Eye Clinic, and they said that corneal collagen crosslinking is a technique that was first used in 1998 to treat patients with a disease called keratoconus. And in keratoconus, the cornea, and you can see this picture here, the one on the left is a normal cornea, nice and rounded shape, and the one on the right is where the cornea gets real thin and it bulges out into almost like a pointy cone shape, which blurs the vision. So that's the condition called keratoconus. And so normal corneas have these little cross-link fibers, collagen fibers, that keep it strong and keep its shape. But in this keratoconus, it loses that and it's too weak. So the weakened structure allows that cornea to bulge. So what I underlined here, the cross-linking procedure adds cross-links or cross-beams to the cornea, making it more stable, helping it hold its shape, and focusing power better. So apparently it's a pretty popular procedure because it's not invasive. So regarding how to code it, it's still considered investigational. So many insurance companies, they simply aren't covering it yet. So your best choice is to use the unlisted code. If you could scroll up a little bit. Now I know how you feel when I'm driving. And that's 92499, unlisted ophthalmological service or procedure. You can try and get paid. Chances are you might not until it starts getting more recognized. And then here's some common diagnoses that I found on a payer's website that I just decided to copy and paste into the answer sheet. And they give you ICD-9 and ICD-10. So we can see that keratoconus is the 371.60 to 62. And if you scroll down a little bit further, I wanted to share some resources. There's one especially, I was going to try and play the video. That second link, if you could click on that, Alicia, really good videos. And Alicia's a big one for finding and sharing videos, but this one really explained it very well. It shows like what they're actually doing is putting these drops on the eye that get absorbed into the area where there's the cross links, and it actually creates cross links, and it's just from these drops, and then you're done. So so that's the video there.
The cornea is the clear surface that covers the front of the eye. The cornea is made up of millions of fibers that are linked together to maintain the cornea's shape. Certain conditions, like keratoconus, can weaken the links between these corneal fibers and alter the cornea's shape. This leads to distorted vision that worsens over time. Glasses, contact lenses, and corrective corneal implants are used to compensate for this, but the problem can progress to the point where the cornea must be transplanted to restore useful vision. A corneal transplant is an invasive procedure requiring a lengthy recovery period, lost time from work, and carries a high risk of post-operative complications. Even if successful, the quality of life for corneal transplant recipients is significantly impacted and often requires them to make permanent lifestyle changes. Today, a procedure known as UV crosslinking is a simple, minimally invasive treatment that can stop the progression of keratoconus and similar conditions. While crosslinking cannot reverse the distortion of the cornea, it can prevent further changes. Studies have shown that crosslinking preserves vision and avoids the need for a corneal transplant. The crosslinking procedure begins by administering drops of riboflavin solution to the surface of the cornea. Once the cornea has been saturated with the solution, a small amount of UVA light activates the riboflavin to strengthen and stabilize the weakened links between the corneal fibers. Most patients will not require more than a single treatment. If you or someone you care about suffer from keratoconus or a similar condition, ask your doctor about cross-linking and find out if you are a good candidate for this procedure.
I just thought that was a really excellent video. Although I think the way that we teach are a little bit more fun to listen to. But the image was so clear. I mean, of course, if it was just that clean to make a cut like that, take it off, put it back. But the point is that it's an alternative to going all the way to doing the transplant. But it's just not covered yet by a lot of payers. So use that unlisted code. Probably the next step is they're going to come up with a Category 3 code where it'll be a temporary code that you're going to use instead of the unlisted, see how many people are using it, and then it'll hopefully get a permanent code in CPT. So, but there's a bunch of references there. The last one was from Anthem. It's just a sample policy where they describe that. So, part of our philosophy is teaching you how to fish. So I used Google and I literally typed in corneal crosslinking, started exploring the links, found the site on Anthem. They explain all about it. So you really can be your own consultant and, figure out answers to, things like this. I'm going to show you on the next question on how to do special searches. I've shown it before, but it bears repeating because it's very, very helpful.
Do you need more medical certification training? Go to www.cco.us. And don't forget to subscribe to our YouTube channel for updates.